Well, good morning, everyone. It is very, very nice to see all of you this morning. We welcome you and we'll welcome you to a new school year, and can't say how nice it is to see you. I'm going to be on with you just for a few minutes this morning. I wanted to have the opportunity to welcome you back, first of all, and also to introduce you to Lena Kate. Lena has joined the School Nurse Corps team. She is our team leader, and she's going to be taking on some of the work around the goals and objectives of School Nurse Corps and helping us with our Department of Health and our OSPI deliverables that we've been tasked with, and all of them really relate to our work with public health. So all of our work with our LHJs around immunization support and air quality guidance, all of that, Lena is going to be our support person in working through those things. So we are very, very pleased to have her joining our team. I'm going to share my screen for just a second because I don't want to leave anybody out of this introduction. So I'm going to share, and then I'm going to share my slideshow. Can everybody see this? All right. So along with Lena, I also want to welcome Kathy Hunt, Danica Morovic, Danielle Ibarra, Brittany Schmidt, Olivia Booker, and Jana Benzel. They're all either new to school nursing or they have experience as school nurses, and they have just taken on new positions within our region. So we welcome you to our North Central ESD team, whether you're a School Nurse Corps district or if you are a Class 1 district. We're more than happy to work with you, and just want to let you know how much we appreciate you and welcome you. And with that, I'm going to be turning over the program for now to Lena. I'm at the virtual care conference today, and we're focusing a lot on how we're going to be able to implement virtual care services both in our communities and our school districts. So I'll log off and let Lena take on the facilitation of this meeting, and welcome Dr. Wallace. Very good to see you. All right, I'll catch up with you and do some updates for you on some of the state guidelines prior to the end of the meeting. Thank you.
Hi, Kathy. Thank you. So greetings, everyone, to the first school nurse meeting of the school year. As Kathy introduced me, my name is Lena Kate. I am new to the area. My family and I just moved to Bridgeport from Selah, Washington. So I'm a transplant in your area and still getting to know all of the places and names and faces. So as I reach out to you to just pop in and say hello, please don't be weirded out if I am still asking you, where are you at? Where is this located? Because this is a huge area. My previous experience was in the Yakima School District, so I'm used to a school district of 16,000 students. And so having this large of an area to cover still kind of blows my mind. So thank you for your grace while I kind of get up to speed with this. I can see that we have 27 people on the call right now, so I'm just really excited to work with you and for you in trying to help our students and their families be healthy and reach their potential in school. I can see that we have Dr. Wallace on here, who is our health officer for the Chelan, Douglas, and Okanagan counties. Am I right, Dr. Douglas? Or Dr. Wallace, did I do that right?
Yeah, you got it. Thank you.
Okay, awesome.
Lena, nice to meet you.
Good to meet you too. So today we have a little bit of everything when it comes to school nursing. We've got our public health updates with Dr. Wallace. We have Michelle Rogie, who is hopefully going to be able to join us here shortly. She texted me just before the meeting and said that she had an emergency. Surprise, surprise, school nursing. so she'll be stepping back in with us to go over SMARTY goals and how we can make the most of our time and organize our work goals. And then we also have Nicole Smith. Please, sorry, Nicole, I'm trying to find your name on here. From the Brewster School District, who's going to talk about health room management. And I found this so interesting because this was something that I implemented in Yakima as well. So I'm really, really curious to hear her angle on health room management as well. And then Kathy will be joining us again to go over the latest in school nurse update for our region. So without, there's too many people on here to do a quick introduction, unless somebody's burning to say hello. I just would really love to have your questions. If you could keep track of them, maybe save them for the end when Dr. Wallace and Elizabeth Walker are done speaking, so that way we can get through their updates, and then whatever questions you might have, if we could ask them at the end of when he's speaking, that would be wonderful. And same for Nicole and Michelle. So Dr. Wallace, I'm gonna turn the time over to you so we can get the latest and greatest.
Great. Thank you, Lena. It's nice to be here. Nice to see a lot of familiar faces, and then really good to see new folks, new nurses. I know there are a lot of new superintendents as well. And so really fun to start the year with a mix of veterans and new folks that can come and contribute so much to our school systems. I'm Jim Wallace. I'm a family doctor. I work in Okanogan County, and am the health officer for Okanogan County and Chelan Douglas. Have been in these roles for a little over 2 years. So started in the middle of the pandemic, and certainly learned a lot in a short amount of time, and really enjoy helping school nurses, helping school systems work with and learn from and grow with all the changing information that we have coming our way. And we've certainly learned a lot together. I really enjoy these meetings as an opportunity to hear from you guys, as well as to try and present some helpful information. Today, I thought I would look at respiratory illness, how we're prepared, what we anticipate as far as RSV, COVID, influenza in the coming months. And then I'm really excited to have Dr. Elizabeth Walker with us here on this meeting, but also with Chelan Douglas and Okanogan County Health Districts, providing a lot of support for us as we look at our wildfire smoke preparedness. So to jump in on respiratory illnesses, we're seeing an uptick in COVID. Kind of not surprising as we get back into the swing of routines after a summer of less respiratory illness. I think we end up testing ourselves more when we're getting back into the classroom, back into work settings, and so we're seeing more because of that, but also more in more close proximity to folks. And so we're seeing upticks in cases. Cases aren't as well reported as they used to be because of decreased access to testing, as well as the home tests that people are really good at using now. I realize I'm not sharing my screen. I'm just talking at you guys, and I got something a little more helpful. Hang on one second.
Oh, Dr. Wallace, you're muted.
Great. Thanks for the request. Zoom now silences you when you share your screen. So appreciate you letting me out of that trap. We're seeing an uptick in cases, uptick in hospitalizations, uptick in the surveillance we do with our wastewater. And I'm sure many of you are seeing an increased number of cases as students are getting back into the classroom. The dashboard that Department of Health has used for a long time for COVID is actually gone away as of yesterday, and has been replaced with a more comprehensive respiratory illness dashboard. If you go to the DOH dashboard now, you see not just COVID, but influenza and RSV. And it can be really helpful to compare what's going on with each of those illnesses. I think, as everyone remembers, last year we saw RSV peak much earlier in the season and impact a lot more people than in previous years. And influenza jumped onto the scene a little bit earlier. And so this is a way that we can watch what's going on a population level. But I know you guys are all in tune to what's going on in schools, and sometimes that can be even more helpful than what we see on our dashboards. We try to forecast, do our best job of anticipating what's to come for our respiratory illness seasons. We try to recognize trends we've seen in previous years and prepare based on that. Like I said, we had that early RSV and influenza season. And so we want to be ready for that. We also look at each of the viruses we anticipate will hit us in the coming season. And for those that are less stable or evolve more frequently, like influenza and COVID, we try to anticipate what strains are coming and note whether those are more transmissible, more severe strains. That helps us in our preparedness. We know that RSV and influenza started early, so we want to be prepared for that. COVID is already starting to tick up a little bit, so we want our preparedness to include COVID. We want to be prepared for severe illness because we saw a little bit more of that with influenza and RSV than we have in previous years. Fortunately, COVID is not as severe as it has been in 2020 and 2021. And the variants that we're seeing for COVID are no more severe than previous. And then the influenza variants that we're seeing are very similar to what we had last year. And we paid close attention to the Southern Hemisphere winter as well. So the past couple of months of disease activity in South America can help inform what we anticipate to come. The influenza strains down there were very similar to what we've seen. And so I think that the selected variants for this year's flu virus are going to be a good match. RSV is a relatively stable virus, and so we don't have to worry about genetic evolution there, but we certainly want to be prepared for the youngest and most vulnerable kids, as well as elderly, to be protected from that. This year, I think we'll want to get immunizations out sooner. There are 3 now, so in addition to the updated COVID vaccine and the seasonal flu vaccine, there's an RSV vaccine for individuals over 60 years of age and for pregnant women. And then monoclonal antibodies that are better than the older monoclonal antibodies for infants, the youngest. And then certainly we want to be prepared by reviewing and reminding ourselves of respiratory prevention and control. And you guys have gotten very good at this. There are no new recommendations or requirements from Department of Health, and many of the systems that you all have put in place will be just as effective this year, and want to continue to support you in doing that. Those include preventing and reducing exposure by making sure kids and staff members stay home when they're sick, maximizing ventilation, reminding kids and staff of respiratory etiquette, covering your mouth, washing your hands, disinfecting surfaces that might have been in contact with folks that are sick. And that goes for COVID as well as influenza and the common cold and everything else. Still, recommendations for masking are 10 days after an individual's been exposed or 10 days after the onset of an illness for COVID. And testing continues to be really helpful for folks that are symptomatic, people that have recently been exposed in outbreak settings. And we really encourage people to continue reporting their positive tests. Schools are required to report tests that they conduct themselves, but encouraging families to report really helps us to track it through local health jurisdictions, but also reach out and ensure families are supported. We still have resources to support people that are isolating or have to be at home or missing work, and want to make sure people know those are still available. A number of schools are really good at reporting outbreaks. We've seen some as we've gotten started this year. Reporting to the LHJ is a requirement and is super helpful because we can support you guys and do whatever you need for us to do to help with communications or help with testing resources or the protocols you guys put in place for responding to outbreaks. Important to communicate broadly and then specifically to those cohorts or classrooms that are experiencing outbreak. So that's what I wanted to share with everyone on COVID. I wonder if I could stop here and take any questions you might have or hear your experiences, early experiences this year with respiratory illnesses before I pass the presentation on to Dr. Walker.
Let me check the chat and see if there are any questions in there.
Yeah, sure.
Melanie says, is there an updated COVID system or symptom decision tree? The latest I can find online is from February 2023. Is that what is posted on your slide?
Yeah, that's the one that's posted on my slide. It's the one linked to the most updated K-12 guidance, and that came out in May of 2023. And I think that's the decision tree that was released in February.
Okay.
Great question. Thanks.
I have a question.
All right.
Are people
Yeah,
still,
please.
people still having, still using the iHealth or the COVID testing kits? A lot of the talk that I've heard from the testing, they're not called testing coordinators anymore, but the others at ESDs around the state are having difficulty getting more of the at-home testing kits, or are contending with bumping into the expiration dates on those kits. And from what I understand, if you can still see that line, the control line on the COVID testing kit, then you can still use it. Have you seen in your clinics or with the health district, are we starting to move away from using those, or are those, what's the latest with the testing kits?
Yeah, no, if you have them, use them. You're exactly right that even when the expiration date has passed, if you can see that control strip, then it's responding appropriately to antigen on the test. So continue to use those. We try to order and have as many at Chelan Douglas and at Okanagan. I think Grant County does the same. So reach out to your LHJ if you find yourself, in the middle of an exposure scenario or outbreak situation where you want to start doing a lot of testing. I know from communication from my school that the recommendation comes that kids get tested at home, and so we're certainly trying to do that as a family. But please share best practices, experiences, and reach out to LHJs for more supplies if you're running out of those.
One other thing to note too, with regard to if anyone is thinking about doing testing at the school, we are bumping into the issue of having your CLIA waivers I believe those were rescinded or expiring or something to that effect. Sorry, I was not thinking of CLIA waivers when I logged into the meeting today, or I would have looked it up. But I know that the state has put out language about the no longer having those CLIA waivers for schools. Am I off base on that, or do you know anything about that, Dr. Wallace?
I'm not sure. I'm sorry, I don't know whether the CLIA waiver was something that schools carried for their testing prior to COVID, prior to the emergency, and whether that's something that's expired. So,
I only brought it up because I know we did have an emergency use for the CLIA waivers to do testing in schools, but I believe that that is has ended or is ending soon if it hasn't already. So,
yeah,
and I saw a few people nodding. So,
yeah. Yeah, and Lena, we could follow up, and if there's anything that the LHJs could do to empower the continued use of those testing platforms, then we'd certainly want to make that possible.
Okay, someone just put in the chat here. Let me read it really quick. I thought the CLIA waiver covered nurses still, but it no longer covers staff to test. And I believe, Sarah, I believe that is probably what you are better articulating what was on my mind. So thank you for putting that in the chat.
There you go. All right, well, let's shift gears real quick. I'm excited to hear from Dr. Walker. She is a toxicologist by training and has become one of the leading state experts in wildfire smoke. Works through the UW Department of Environmental and Occupational Health Services, but is also with us at Chelan Douglas in Okanagan and serves the region. So great, she's already transferring her screen. And some of the coolest work she's done is working with communities in North Central Washington around being ready for wildfire season, ready for heavy smoke events. So we're really lucky to have her. I know she's done some work with schools already. So I'm glad we have this resource for our entire region. Dr. Walker, go ahead. Thanks for being with us today.
Thank you. Yeah, and thanks everyone for having me here today. As Dr. Wallace said, I've been working for about the last decade now in air quality in our region, and especially as wildfire smoke has risen in level of concern and priority for public health. It's been wonderful to see a lot of attention and thoughtfulness as we evolve and become more sophisticated in our guidelines. You know, for a long time, when I started doing this work, even just 5, 6, 7 years ago, when it got smoky, we would just tell people to stay indoors. And we now have a much more nuanced appreciation for how to keep people healthy and safe in wildfire smoke. I'm a toxicologist by training, as Dr. Wallace said, so that does inform how I think about this, mainly in terms of exposure reduction strategies, as well as who is most vulnerable. And all of you, obviously, in our schools care for some of our most vulnerable populations with wildfire smoke. And so thank you for your attention to this really important topic. You know, I'm also, as a community member here, and I'm raising children here as well. From an exposure reduction strategy, I really think big picture about how we can all together learn to live in a healthful manner with wildfire smoke. We know that fires and smoke are here to stay. They're likely going to get worse. And we need to figure out how we can do things and live our lives here, especially through the seasons of wildfire smoke, where we're often really enjoying spending time outdoors, enjoying being active, And how do we continue to do those in a way that we're balancing sort of the risk of exposure to wildfire smoke, but it's still experiencing the enormous benefits to our health of being physically active, and participating in those activities that bring us so much joy. That's really true as well for children. Clearly, many of your school districts have likely opened with the first day of school coinciding with some wildfire smoke. And so I imagine my starting place in talking with you today is that you're all probably somewhat familiar, if not more familiar than you'd like to be, with thinking about how to deal with wildfire smoke and the children you're responsible for. So what I have up on the screen here, and I dropped a link in the chat. Apologies, I accidentally put it in while Dr. Wallace was still speaking, but I'm going to give you permission because I'd really love for all of you to take that short quiz. Probably is about 2 minutes. I think there's 5 questions, just so we can have a better appreciation for looking at where our baseline is right now with how our schools are thinking about outdoor and indoor air quality and wildfire smoke for their kids. So thank you. I give you permission to hop on over there and do that. I think you can use your ears at the same time to catch the content here. I'm starting with some slides that were passed along by Caitlin Kelly, who is the air quality specialist at the Washington Department of Health. She's been a phenomenal leader, along with others in her group, in developing guidelines, including the Washington Children and Youth Activities Guide for Air Quality, which will likely be the reference and guide that you are most familiar with. This guideline, I believe, is at least 4 years old now. It's updated every year, and there was a somewhat significant revision that took place between last year and this year on the basis of a lot of conversations that DOH undertook with folks that are utilizing this guidance most closely, including school nurses and school communities. I am also on the team that helped make these revisions, so I'd love to hear from you with regards to whether this newer version is more helpful, if there's still some confusion or difficulty in its interpretation and application, because it's much more extensive this year. So I'm going to briefly walk through some of those changes. They're summarized on this slide. So the first bullet point here that starts with improved clarity. So one of the things that we heard about what wasn't very clear in the last guideline was how to understand actions to take for different durations of activity. So the new guideline breaks down activity duration for different air quality levels, and then what types of consideration or actions might need to be taken. And so the activity durations are broken down to 15 minutes to 1 hour, which would include things like recess, PE, or classes that might be held outside. 1 to 4 hours, which would cover most athletic practices or events, and then greater than 4 hours, which would be, applicable to all-day field trips that were going to be outdoors or multiple day activities. The second change is the recommendation to consider canceling outdoor activities for activities that are of a greater than 1 hour duration when air quality is in the 101 to 150 window. So this recommendation is not different, but 151 is where excuse me, I'm stumbling here. I'm actually going to go ahead and move to the next slide because I think it's easier to look at it in the table. But the main point here is that 151 still remains the threshold of concern where we all really need to be paying attention. That's where air quality becomes unhealthy for everyone. And unless activities can be moved to safer air quality, either in a different location or indoors, or if you can modify the intensity level or duration of the activities, we really don't want kids out in air quality higher than 151. But again, thinking about that threshold, there are some things that you can do. So again, if the activity can be moved indoors to better air quality or moved somewhere else, or if it's a practice And instead of having the kids run wind sprints the whole time, you can have them practice passing or something that's of less vigorous activity level so that they're not breathing as hard and taking as much air. Those are acceptable ways to modify that activity. And then the other big change to this are the addition of some appendices that give a lot of detailed information about indoor and outdoor air quality monitoring and the use of low-cost sensors. And I know that a lot of schools are starting to think about doing this. So this guide is available not only in English, but also in Spanish, Russian, and Somali. And then this email address here will take you to Caitlin and the air quality group at DOH. So this is what this looks like. It's a ton of text, as you can see. And if you have questions about air quality in your school community, I bet you can find the answer in here if you're willing to have the patience to look through here and make the time to read really carefully. It's also formatted in a way, hopefully, that this can be a good tool to utilize with your school community, with interested parents or staff, so that people can sort of find what they're interested at a glance. So on the left, this table is the one that is new here. So this is what I was describing, whereby if you're thinking about helping provide advice or brainstorming with your school about, wow, it's smoky today, what do we need to do, if anything, you can look to the activity duration and then figure out what the air quality is. And, you know, it's really once we're in this unhealthy for sensitive groups, this 101 to 150 threshold is where we start really wanting to pay attention, and schools are doing a lot of problem solving around this in terms of activities for their kids. So the backside, so when you print this, if it's two-sided, this is a one page, so you can go to the backside. And then the backside of this, as I said, calls out a little bit of information and education that is great for all of us to possess in terms of where we might be exposed to PM 2.5. Again, thinking that this is most likely something we're going to need to use during wildfire smoke season. Why children are at increased risk, why we consider them sensitive populations, what symptoms we might need to look out for. A big portion on physical activity. And this not only talks about why physical activity results in greater exposures to PM 2.5 or smoke, but it also talks about what we know about the incredible importance of physical activity and, you know, references that we've been trying to move kids and get them to move their bodies more and more for many, many years to combat other risks like obesity. So again, this is really a situation where we want to think about what benefits the kids are going to miss out on with regards to restricting physical activity. The next row talks about the ability to, let's go back here just a sec. Okay, next one talks about some strategies that we can use for reducing exposure and thinking about that long-term strategy to reducing exposure wherever we possibly can. And that, you know, these are really lifetime exposures that we're going to be concerned about. The use of masks or respirators, and I'll just highlight this link here, takes you to the Western States Pediatric Environmental Health Specialty Units guideline on children in masks, which I think is a really, really nice guideline that came out a few years ago. Talks about how do we find out what the air quality is, both outdoors or indoors, where maybe wanting to move children, and the use of these low-cost sensors. And low-cost sensors are often $100, $200. They can be enormously helpful tools for schools to understand where they might have indoor air quality issues. And especially, you know, these can be utilized for spaces where you may be keeping children inside to have physical activity like gyms. So those are the places where these can be of the most use. Strategies to improve indoor air quality, and then some other information about what's relevant for adult staff and volunteers, what unique from children specifically. We have a reference to the school closures guidance, and then some additional resources. So again, you know, we're really lucky. Washington State is one of the leaders in thinking about wildfire smoke. And so we do have a lot of information, all of which is linked in this document. So then briefly, the additional changes to this guideline this year are these 3 different appendices. And as I said, we've gone from just telling people to stay indoors when it's smoky outside to really raising all of I refer to it as air quality literacy. Several years ago, lots of folks had no idea what AQI stood for or PM 2.5. And now lots of people are checking the air quality index and air quality on a daily basis, just like they might think about the weather and start to plan their days accordingly. So these appendices give you some more information about where to find what the outdoor air quality levels might be. And similarly, if you are thinking about establishing an indoor air quality monitoring program or want to know what the indoor air quality in your school might look like, what some considerations and resources are available to you, that's Appendix B. And then Appendix C gives some more resources for once you've actually discovered what the indoor air quality looks like, what are strategies for improving that? And, I think it's actually quite beneficial for us. We had to think about this a lot during COVID. And so while the strategy to get better ventilation in the schools to prevent respiratory virus spread is not compatible with thinking about if we've got smoky air outside, things like filtering indoor air and improving HVAC systems absolutely are. And so the fact that some of our schools have really worked to improve making their filters, their HEPA filters, as strong as possible, thinking about supplemental HEPA filtration for rooms. Those are all fantastic strategies for wildfire smoke as well. And I will note that Washington DOH does still have and points to, they put together in 2020 a wildfire smoke and COVID-19 guideline that is still applicable and available today if a school is dealing with both those things. And then there was also a frequently asked questions document developed too. So that's a lot of bedtime reading or daytime reading if you can make some space over your lunch break or otherwise. I'm delighted, as Dr. Wallace said, I currently am available to answer any questions and help you troubleshoot, and my email is listed down below. Feel free to get in touch. But, in terms of takeaways, as I started and I'll end, we're really all learning together and thinking about long-term, lifelong strategies for learning to live healthfully with wildfire smoke. We're really paying attention to our indoor air environments. And so, as nurses, you can be advocates and teachers for thinking about and learning about indoor air quality and how that benefits children's health, everyone's health, not just from wildfire smoke, but generally there's a lot of data supporting that. And that we know that our kids are sensitive populations, and especially kids with other health conditions like asthma or diabetes. Those children may become sensitive to wildfire smoke even below the 100 threshold for air quality index. So really thinking about our kids as individuals as well and who might be vulnerable. And then one of the strategies I just wanted to suggest, and another resource that I'm happy to share, I've worked with the Methow Valley School District here. They've actually developed their own guideline that speaks really specifically to how they function around wildfire smoke and what behaviors and strategies and team individuals on a team that they've put together to create healthy environments and keep kids safe. So I might ask you to consider building a school working group if you don't have one already to develop your own guideline. And, again, as I said, that sometimes we're also thinking about concurrent hazards like heat, if schools are utilizing opening windows to keep buildings cool, as well as thinking about things like respiratory viruses. So we're incorporating all of those into creating this indoor air environment. So that's it from my slides. I'll just note, I was going to show one other thing. The other nice thing about if your school specifically develops your own guideline, that can be a forward-facing communication tool with parents. So I'm putting up the Methow Valley School District's webpage here, where they have a section on health and wellness resources. And they've got some language here about air quality and student health that links their own guideline that they've developed, so that's right there for parents to take a look at, and they can just reference that when they get questions over and over again. And the feedback from the school is that this has been really wonderful to demonstrate to parents, that they're thinking about this and thinking about their kids' safety. So I think for the agenda purposes, we're probably ready to move on, but if we have a couple minutes for questions, I'm happy to take those.
Do we have any questions? That was a lot of really wonderful information, really condensed in a short amount of time. So thank you very much, Dr. Walker, for being with us and sharing your insights on the wildfire smoke. And thank you for sharing your email address. We can make sure that our nurses have that so we can email you directly with questions as well. I haven't seen anything in the chat as far as questions go. So if anyone has anything that they would like to ask right now, or if you're wanting to submit a question to her later, we can make sure we get in touch with, make sure that we can get you two connected to answer any questions.
Great. And thank you so much if you were able to pop over and take that survey. It's really helpful for our region all growing and learning together and knowing where schools are currently and what additional support you may need. So thank you.
Awesome. Well, thank you so much for being here. We don't want to intrude on your time. We know you're very busy as well as with all the other things that you have going on. So if you would like to stay for the rest of our meeting, you are more than welcome to, but please don't feel like you have to. And thank you again for being with us. So we're going to transition over to hearing from Michelle Rogie from the Manson School District. I'm only smiling because I keep getting Mansfield and Manson mixed up. And so poor Michelle has had to correct me several times about which district she works in. But Michelle, I'm going to turn the time over to you to discuss Smarty goals and making them work for us.
Okay, sorry, I'm running around like a chicken with my head cut off at the moment. Can I have screen? Can I share my screen? Oh, I can. That's what I needed to do to be able to, hopefully, you're not seeing the right screen, I bet. I bet you are seeing I love this part. I like an idiot, this part. Ah. I hate screen share.
Well,
So
Michelle, we were seeing your PowerPoint before you hit slideshow. So we might
may have to go this way.
No, just hit slideshow.
So I should be able to hit right here and go. Now, can you see it okay?
Yes.
Okay, perfect.
Looks good.
So after I had my site visit with Kathy last spring, I had shared with her my goals and how I do that. And so she asked me to share this with you. So I'm not going to go too detailed. And Sheila and Lena both have the slide deck and the documents that are in it that they'll send out after the meeting. So you've got the slide deck and the document that I use. So today we'll talk about what is a Smarty goal and how I use the scope and standards book, this book, which is not going to show very well because I have my background blurred, and what you include, setting steps along the way, and then successes, fine tuning, and restarts is what I called it, because last year was not my most successful goal year. Most of you are aware that there's a formal goal setting process that goes into effect for educational staff. Theirs is called Teacher and Principal Evaluation and Growth Program. And every year I was getting this email saying, set up a goals meeting with your supervisor. Okay, how do you want me to do this? And one year they sent me through that and I went, nope, not doing this again. So this was my own way to find something that was applicable to me and allowed me to set goals that I reviewed with my principal, who is my evaluator, in the fall and then again in the spring. And how did we monitor those things? And they could see what I was doing and something that was understandable to both. So what is a SMARTY goal? I've heard SMART goals. We've all heard the latest lingo on them. SMARTY is the new word. And so I'll talk about the different pieces of SMARTY because a couple of those letters were new to me. So there's specific, so simple, sensible, significant. What do I want to do? What is come up with exactly what you want to do? And that's really what that specific part is. Why is it important? Who might be involved? It might be more than you. It might be just you. How will I get it done? What things am I going to do? So those are several different pieces within it, but making sure that you're very specific so that it's understandable by you and whoever you're sharing with it. Measurable, how much, how many, how will I know when I've done it? Things that are, I can say, yes, I completed 10 hours of this, or I reviewed all of that, or whatever at the end of the year to really show progress on that. Did you complete 70% of it or something like that? Achievable. Is it something that you can do? How realistic is it with the resources? If it's something that requires a lot of resources, is that something that you have the financial resources? Do you have the people? Do you have time? So really, I usually start in that area. I don't really do these in this particular order. These are the order of the letters, but I really do the achievable first because I don't want to start planning to do something that there's no way I can accomplish. And then relevant, is it reasonable? Is it realistic? And can we get the resources? And is it results based? Is it something that that's part of that measurable as well? So why is it relevant? What is it going to do for your students? What's it going to do for you? What's it going to do for the district? Time bound, by when? So when are you going to accomplish it? And when we get into other components that are parts of that, writing that goal, I'll talk more about how you've got short-term and long-term pieces. But is it time limited? What costs do you have? Is it time sensitive? And are you going to get it done in a timely fashion? And then how are you going to break that down, which we'll talk more in a little bit. Inclusive. These are the new pieces. So that's where SMART goals stopped before. They've now SMARTY goals are also inclusive. So do we look at traditionally marginalized students and families as we're looking at policies or decision making or activities that we're doing? Is it going to focus on that group? Is it going to be inclusive of that group? And then equitable, how does it seek? Is there an injustice or an inequity within your district that you're trying to correct? Is it something that not everyone has access to? We went through that with COVID. A lot of us worked on getting vaccination clinics at our schools just for access purposes, not forcing anybody to do it, but just for access purposes because it was an inequitable system for everybody to gain access. So those are kind of the pieces that make SMARTY up as a word. Like I said, I use my scope and standards book. It's blue right now. It changes color every time there's a new one. And I go through, this is the form that you'll get from Sheila or Lena. I'm not sure who will send it out. I use this template. You'll get it in a Word format so you can type right into it. Really easy. Who am I? What school district? Evaluation period. And then I look at the standards of practice and standards of professional performance. So really, if you look at those, there's 18 of them. The first 6 are really standards of practice. And then the remaining 12 are professional performance. And I try to set a goal in each of those areas. So last year, for example, my standard of practice was I looked at all my kids that had asthma diagnoses. I think you'll all agree that kids get asthma diagnoses thrown on and then they're there forever. And we go through the expired inhalers in our cupboards every year that they never use. So really going back over all of those kids, communicating with doctors, is this still an accurate diagnosis? Because my asthma numbers were just growing and they weren't really accurate. So how could that was kind of the dragon I chose to slay in that manner. And then in my professional performance, my intention was to take my national boards last year, but after illnesses and losing my dad, I did good to get through the school year last year. So that's where I said we'll talk at the end about restarts. That's what I'm doing this year. So I really pick a standards focus, and it goes over in this far box at the standards focus, and then a competency focus. And they're pretty open. You can put a lot of things in there, but then it's easy to go to those scope and standards, share it with your evaluator, and they know what you're looking for. They know what's driving it, and it's something that is your scope and standards for your practice. Not teaching, it's not, it's hard for them to come up with goals, or it was hard for a lot of years for me to come up with goals that were things that they could understand and I could understand. And then down at the bottom of this, and it flows on to another page. So you'll get a couple of page document that you put in these, what is your goal statement? And we're going to talk about each of these components in a minute, but I wanted to review them on this piece of paper. So you can just type right into these boxes. There's a place on the second page for you and your evaluator to sign it. Super easy. I emailed it to Kathy when it started, and just easy to share that way, easy to look back on. So what goes in, what do we include in those? We have lots of little boxes, as with everything. And so what are you going to accomplish and why? That's, be specific. Make sure, why is it that you want to do this? Why did I want to do with asthma? I wanted to be sure that what I was reflecting in kids that were asthmatic were really the kids that we needed to watch. I didn't want us watching for kids that really didn't have that condition. I don't want to clutter up lists of student health conditions with kids that teachers don't really need to be concerned about that as a current situation. What steps are you going to do along the way to reach the goal? How was I going to get there? I started out by I needed to pull the report of who are all my asthmatic students, who all have that health code. So that was where I started. And I then set myself over on the far column a timeline. What was the date I was going to have that done? So as I put in activities, I kind of put them in the order that I would do them, and then spaced them out for myself over a timeline. I was going to pull all those reports in October, once I was sure everything was in for the new year. Then I was going to review the documentation I had to support any of them and what was my deadline for that. So with each of those steps, in that column, I had several steps, and then I had a timeline to go with each of those. What was my expected outcome? And how was I going to know that I'd reached that goal? So how is it going to impact the student's health? Well, the kid doesn't need to put an inhaler around, or I don't need to have an inhaler in their cupboard if they don't have an active diagnosis. So it was going to impact the accuracy of information that I had, and who I was focusing my efforts on for care plans. So my kids that truly were asthmatic were going to get more of my time in managing those things. And then what could I see, or what could I show my supervisor who's not a nurse? How could I show them? So I could show them that I started with this many asthmatics listed, and after verifying everything and finding out if those were kind of one-time situational things, I now have this many. So that was easy for them to see. What resources do I need? Did I need money? Did I need equipment? Did I need time? The one that I did for myself for professional development stuff to do the national boards, I needed money because I got to pay the fee to take it. And I needed study materials, so I had to have that. And then I needed to figure out a plan for myself. Where was I going to allot time to study for it? So those were the kind of things I put in there. And then, like I said, timelines. What's your deadline for yourself for each of those? And this is just something I keep in the front of my day planner so that I can kind of touch back on it regularly and say, okay, what at the beginning of each month, I kind of looked, okay, what was my part I needed to complete this month? And in that activities and actions section, I put weekly, daily, monthly, whatever, at whatever frequency I needed things to happen. And they were all things that led toward those long-term, the final goal. And I think of those short-term steps as rungs on a ladder. So you take one step at a time. And then the long-term step, these are the plateaus between ladders. You may have more than one.
It looks like Michelle froze.
Oh no. Michelle, can you hear us? I'll try messaging her.
I did it through the chat. If you want to do it through her phone, maybe.
Okay,
Looks like she's signed out, so she probably has signed back in,
Okay.
looks like.
okay. One reason I really like these Smarty goals is because it gives us an opportunity to really focus in on specific principles of the school nurse framework for our job. Because I know, like, at least for me in the past, I've just gone about my day and hadn't really like thought too much about the framework put out by NASN, but Smarty Goals just seems to be able to help us focus what we do and have a purpose behind it, as opposed to just trying to roll with the punches and keep up despite all of the interruptions in our workday. I am not seeing a response from her at all.
And I just sent her an email.
Oh,
All of
she
this
just
information, is she back on?
no, she just messaged that apparently they had an internet and phone
Oh,
outage in their district. That is too bad.
all of her information will be saved to our Google Drive. So those of you that have saved that link, it'll be easy to find under meetings and then the date. If you aren't familiar with the Google Drive, let one of us know and we'll make sure you've got that link.
Yeah. We can either make sure you have the link or even just do a quick tutorial on how to navigate the Google Drive so you can find it. It'd be good practice for me because I'm still working on learning the Google Drive myself. One other thing to note about the Smarty Goals is that they are a tool that is used in the Best Mentor program. So if any of you have done the Best Mentor training, I'm sure you will recognize the Smarty Goals as well. They're a tool that has been used for it's adaptable in a lot of different situations. And I see Michelle is back on. Yay!
Oh, good.
Okay, I'm back on, but I can't screen share because I'm on my cell phone because all our phones went out, phones and internet went out district wide. So
if we have your
but
presentation, we can run it for you.
Okay,
Yeah.
I'm on the steps along the way. I've only got 2 slides left. So
Okay.
steps along the way, I just kind of put in benchmarks as to where I put things on hangers in my brain. So in September, I develop my Smarty goal or goals. In October is usually when in our district we have meetings with our supervisor and share those goals. I like to restart the year in January and kind of look and see, okay, where am I at? Where are things going? What do I have to accomplish now? In March, review them again, kind of revise them as needed. And then in May, is when I have my annual evaluation and when I can share that process with my evaluator and where did I get and what did I accomplish. Give yourself grace. Successes, fine tuning, and restarts is so important that you celebrate the successes you made. I'm actually on the next slide, Sheila. And be gracious with yourself. Best laid plans don't always turn out how you planned. I did not plan on a mom to have a stroke, a husband to have neck surgery, and to lose my dad all in about 5 months last year during the school year. So I got the asthma one done, and I have the books to study for my test, but it just did not happen. So give yourself grace. Okay, gonna restart that one this year, and we hope it goes better. Be prepared to fine tune your goals. Realize you may get to a step and go, okay, that sounded good on paper, but in practicality, that's not how it's going to be accomplished. And like I said, allow yourself to restart if it just isn't happening as you planned. That's okay. We don't always have successes. We don't always proceed the way that we want to. But I like to have sort of goals for each year so that I know which dragons I'm going to slay over the time frame. And I come from long-term care for a lot of years where there were certain things you had to do, and there were people with big hammers that came and let you know if you didn't do them. and we don't work in that kind of environment. We have to be self-driven. We know what we've got to get done, and nobody else really cares most of the time, as long as there's not anything that goes wrong. So it's okay to take control of your own plans and stuff. And then I included on the last slide my email address, my cell number, and my office number. And I'm happy to be a resource. And like I said, Sheila or Lena, one or the other, will send out the documents afterwards. So you'll have the slide deck, and I'm happy to even share if somebody wants to see what mine was last year, kind of how I wrote it. I would be happy to do that. So, and if anybody has any questions, I'm happy to answer them or try.
I have one.
Okay.
So how did your asthma numbers work out for you?
They came down about 25%. I had about 25% of the kids that were situations that they had bronchitis one time and they gave them an inhaler to get through it. And then it went on, and they didn't really need it anymore. But I don't want to pack those inhalers for teachers to take on field trips, or, there's a lot of paper chase that we do just to get that stuff. And when I was throwing away expired, unopened inhalers, I knew we had something I needed to review. Sorry for the technical difficulties. It's been a morning.
Okay.
I'm sure it's Monday, right?
I am just impressed at your tenacity, because if the internet and phones had gone out, I might have just said, sorry, guys, good luck.
COVID taught tenacity to a lot of us.
Yes, it did. So thank you so much for persevering and sharing with us, because there's nothing more frustrating, I think, about the job than being interrupted constantly. And if you don't have a goal in mind, then sometimes it just feels like you have a wasted day at work.
I just felt like it was Groundhog's Day over and over again. It was like, I want to do, yes, it's nice to have our new superintendent said it's nice to kind of have a redo every year. It's kind of like in August, you get to start over again. But it was also, I didn't want to just do the same things every year. I wanted to do things that, improved what I was doing, improved my knowledge and that kind of stuff.
Well, and it sounds like you were really able to help quite a few of your students with asthma to be able to kind of get a better understanding of what actually is happening for them, instead of just perpetuating, oh, you have asthma, here's the paperwork, you need a new inhaler for this coming school year. So good work. Good work. Thank you so much.
You're welcome.
And so and we all have Michelle's contact information, and we will get the slide deck and the Smarty Goals worksheet out to you after the meeting. So if you have any questions for Michelle, or want some fine-tuned guidance, you are more than welcome to reach out. I'm volunteering it for you, Michelle, even though I know you already said it. So, but we're going to move on. We have Nicole Smith from the Brewster School District is on and is going to share with us the 7 B's. Michelle or Nicole, remind me of the whole title again, the 7 B's of when to visit your school nurse, or
yeah, when to see the nurse.
Perfect. All right.
Okay, let me see. I've got all these screens. And it looks like I'm looking up because my camera is down and I'm looking at my screens above. So I apologize for that. Okay, you guys can see my slideshow, health room management. Okay, perfect. And everyone can hear me. Okay, so my slides are a little, it's going to be kind of the presentation that I gave to my staff, but with a little bit of information for you guys as well. So just bear with me. And I get nervous when I have to present, so bear with me there too. In response to a reduction in staff in the health services this school year due to decrease in funding, I stewed on this all summer, and I wasn't looking forward to coming back because I didn't want to see 26 kids a day in the health room and not be able to get anything done. You know, when you're seeing that many kids for anything and everything, you're just nuts. And so I thought, okay, what can we do to make this a better school year? So I borrowed the 7Bs. It's also out there as the 8Bs. I presented it to my principals. They said, yes, let's do this. I think it's time to do this. So anyways, that's kind of how all this got going. And the whole goal of this is to create a more efficient use of the health services with less staff. We are still a +1. We have both Elvia and myself that work in the district, but the last 2 years we had a health room assistant that worked in the elementary that saw most of the the first aids and stomach aches and headaches and all those things throughout the year. So the school nurses were able to do the care plans and meeting with students and all the other things that we have to do. So that being said, let's see if my slideshow will go. Okay. Oh, let's go back. So I gave my staff a little bit of an update. Last school year, like I said, we had me full-time in the district. We also have Elvia. She's our migrant health nurse, part-time in our district. She also worked part-time in Pateras, is their school nurse. And we had an elementary health room assistant. Collectively, the team saw approximately 4,032 individual student visits. This does not account for all the phone calls and all the things that we do. Because we don't document every single thing. I wish we did, but we don't. But we document a lot of things. This year, our health services, we have myself, full-time in-district school nurse. We also have Elvia. She's still working part-time in Pateras, and we do not have an elementary health room assistant. Some other things to note. 21-22 school year, we had about 4,500 visits. That's the year we hired a health room assistant. Last year we had the 4,000 visits, and that was 1,100. Let me see. Okay, so 21-22 was 2,900 health room visits and about 1,600 COVID visits. So we kind of separated those because one of us was doing COVID and the other one was doing the health room. Last year we had 1,100 more visits than the previous year in the health room. And that was not just COVID, that was everything. So we averaged 23 students a day. All right. So what I presented to my staff was, this is what everyone thinks a school nurse does. I've heard this comment from everyone, and it frustrates me because school, as we know, we do way more than Band-Aids and ice packs. So clarifying the roles with the staff. I showed them this slide. I'm not going to read it because we all know what we do. I just wanted them to see some of our major duties. We provide first aid, chronic illness management, care plans and medications. We do a lot of health education. We're case managers, a liaison between families and healthcare for students with special needs. Immunization compliance, our mandated screenings, and a whole heck of a lot more. I then showed them the NASN SNO, the definition of school nurse, and said, I'm just not making this stuff up because I think a lot of them wonder, what do you do all day? You're sitting at your computer, you're not doing anything. And by golly, we are. So just sharing with them that we're a professional organization, part of a professional organization, and we do have standards of practice that we have to follow. Okay, and then just some statistics for them from NASN, data from last year. Brewster has about 997 students in the district. I had 114 active care plans and 102 medication orders. That's a ton of work. And then the statistics there, I also wanted them to know that about 32% of our time is given providing mental health services to students. All those stomach aches and headaches. Love them. And we know since the pandemic, there's been a dramatic increase in the acuity of student illness. And through that time, it was, oh my gosh, you have every little thing, come and see the nurse. And they do. They come to us for ripped shoes, and we fix their shoes. Their glasses are broke. Oh, I have, whatever it is, the nurse will fix everything. The students come in the office, the secretaries are like, oh, you need to see the nurse, and they send them. And so it's been really, really overwhelming. Looking at all this, Lena asked me to think about the framework, and I'm thankful that you challenged me to do that. This work that I've done with the 7Bs falls under the care coordination, the leadership, and the quality improvement pieces of the framework. It's a lot of collaborating and communication with admin and teachers, providing direct care of students, student-centered care, leadership, advocating for the students and for ourselves, use of technology, systems level leadership, because this is really about changing the system. And quality improvement, collecting data, entering everything into Skyward. Last year was the first year that I started collecting office visits data in Skyward, and I'm so thankful I did. So I didn't have to hand count all those numbers for my annual report. And it's allowed me to print a report every single month, and I look at office visit numbers. I break it down by teacher, so I can go to the teacher and say, hey, you've sent a lot of stomach aches this month. Let's try these things. So working on that as we go. And that I didn't do that, didn't do so much changing of systems last year. I just collected data for the whole year and then was able to take it to the principals this summer to make these changes. So this is what I showed the staff. When should a student go to the nurse or visit the health room? Let's see. And of course, creating a more efficient use of the health services. So the goal is for students to start critically thinking for themselves and assessing their own health problems and think about how they can provide self-care before they come to the nurse. So who needs to see the nurse? These are our 7Bs, and they're pretty much the same as the other 7Bs. Blood. I'll go through each one of these in a single slide. I also have health room referral guidelines, kind of the same things, but it's things you can try in the classroom before you send them to me, send them to the health room, and that's extremely helpful. I'll share all the materials as well, so you will all get all these materials. And whenever I see students, this school year, I've seen students in the health room for some of these things, and I try to teach them. I'll ask them if they've seen this poster. I have it hanging on the wall on the door. Okay, which 7B does your problem, your complaint fall under? And if it doesn't, then I take the time to teach them how they might be able to take care of their problem before they get to me. So I really enjoy teaching the kids. First one is blood. So if they're bleeding heavily from a cut or scrape and the classroom does not have Band-Aids, you come to the nurse. So this would be any significant bleeding, not a paper cut. Last year it was, oh, I have a little paper cut, or something, and they're coming or a picked scab and they come for a Band-Aid. I should back up also. Last year I created classroom kits for every single elementary classroom that has Band-Aids, barf bags, tooth containers, masks, Vaseline, and Q-tips for chapped lips, all the things that the kids come to see me for that they don't really need to waste class time, seat time. So when I have a kiddo come, if they do come to me, I had a kid with a bloody nose. Oftentimes the bloody noses are done by the time they get to me. So I just send them right to the bathroom, clean it up, and say, okay, next time, go to the bathroom, clean yourself up. If it doesn't stop, then you can come down. Some teachers freak at the sight of blood. So, whatever, we take care of them if they come, but take the opportunity to teach them. Breathing bad, if students have asthma, we all know what breathing bad is. Most of our kiddos know if they need their inhaler and ask for it. The students with care plans for asthma, of course, get a copy of the care plan. get that information and have an opportunity to ask questions. Broken bones, if there's been a severe injury, kids fall off the green toy every single day. I wish we could get rid of all the toys on the playground. And come in for an evaluation. So of course, you know, suspected major injuries, come in, see us. Had a problem with students who say, oh, I vomited in the bathroom and nobody saw it. I don't know. So our vomits, sorry about that. Our vomits have to be witnessed. That's the rule. Of course, you know, there's an assessment that goes along with that and we can determine if they need to stay or not. But too many excuses of, oh, I puked, and they know if they puke, they get to go home. So it has to be a witness vomit. Last year, stomach ache was the #1 visit reason to my health room. We had 391 stomach aches in the health room. Most kids don't eat, you know, they're not eating breakfast, whatnot. So their stomach aches are cured by a snack. So I've taught the teachers, you know, make sure they've eaten, use the restroom, get a drink of water, all those kinds of things. So interesting, but it's awesome to see, you know, the numbers and be able to report these numbers to you guys, and as well as our admin. Burning up, you know, of course, if they have a fever, they can come. Bee stings, if a student was stung by a bee, we don't have a lot of bee stings on the playground, but you know, sometimes we do. Big bumps, of course, if the student bumps their head, every kiddo is assessed for a concussion, and we do take head injuries serious. And then this is our 8B, and I didn't put it on the 7B stuff, but any other bona fide reason, if a teacher wants a student seen, of course we'll see them. We're not gonna turn them away. And I'm encouraging staff to call me. It's easier to get all the information if the staff calls, or if I make a quick call to the classroom to get that information, rather than, you know, the student brings me the nurse pass and says, oh, here you go, and it actually, you know, they have some other complaint or something. So also, our school counselor is going into classrooms and talking to students about a reset hibernation station to be able to check in with themselves. And so all these 7Bs kind of go along with that. And she created this, I can check in with myself questions to talk to them, you know, with all these things. What does my body feel like? What do I need right now? You know, am I drinking water? Did I eat? All those things. So together, we are decreasing the number of visits to the health room. So, and I'll give you that number here in a minute. I created the 7B nurse pass to go right along with all of this. So every student who comes to the health room is expected to bring a nurse pass as well. I can use this as a two-way communication tool to send back to the classroom with the student, or keep it for my documentation. I like to keep notes so I can enter those in Skyward whenever I have a minute. Okay, so here's my data. Last year, the first 10 school days, we had 267 visits, you guys, and it's 26.7 visits a day. Do you know how many visits a provider sees in a clinic? Say take, you know, an FQHC, CDCH or somebody, and they say, oh, we're only going to see 20 patients a day. Well, you know that every student we see is an assessment. It's you know, coming up with a treatment and disposition and all those things. So it's not just here's a Band-Aid and go. We're seeing 26 kids a day last year in those first 10 days. This year we've cut it to less than half, 12.7 visits a day. And some of that documentation is some of our care planning work that we've been doing and phone calls we're making about those things. So it's a lot less. So I think what we're doing is working. And teachers are helping students take care of themselves in the classroom. The ultimate goal is to keep kids in their seats, because we know that if they're not in their seats learning, they fall behind. All right. So this is kind of, I did a screenshot, and my documents are kind of blurry, so I apologize, but this is my health room referral guidelines, non-urgent, you know, problems, how to deal with them in the classroom, and then the urgent ones, which fall under the 7Bs. So I'll be sharing that. And then, yeah, this is really blurry. So when to see the nurse guide for teachers, just all those 7 Bs and, just some blurbs about each one of those. Okay. I didn't add these to my slides, but Elena said these questions might come up, so I'll just address them right now. And so people are probably wondering how I rolled this out at the beginning of the school year. I attended the elementary staff retreat, which is not well attended by staff. All the new teachers were there, but the old teachers weren't. And so it was kind of frustrating because I thought, okay, how am I going to disseminate all this information to the whole staff of the elementary? So I followed up from the retreat with an email to all staff, hoping that people read their emails and pay attention. And so far it has worked. I had planned to go into the classrooms and teach the students about the 7 Bs, and the teachers would get that message as well. But I haven't been able to do that yet, and I'm not sure. I haven't sent a follow-up email to see if they want me to do that. But I can, and I will. And I have a separate PowerPoint that I can share with you that's just for the students on when to see the nurse and then how to, take care of some of those things on your own. Another thing I thought of, I had a substitute teacher send somebody to me with a stomach ache, and I'm like, okay, who's your teacher? They have a sub today. And so in the sub plans, it'd be helpful if the teachers would include the 7 Bs and the health room referral guidelines, all those things in there so that they can have the information as well. And the principal had said he was also going to implement giving each substitute like a folder that had our handbook in there, the student handbook, staff handbook, the health room guidelines, and all those things. So I think that's also a good tool as well. So a lot of information, a short amount of time, it's working. And I feel good. Students feel good. I haven't heard any staff complaining much about it. So I think it's been a really good thing for this year. So any questions? I'm just looking at the chat. So I encourage you, if you are overwhelmed with stomach aches, headaches, all the little things, to get your data together, talk to your principals, and yeah, make some changes.
Nicole, I want to thank you for sharing this. This is a really great thing that you have implemented. What really stood out to me is how much your data has shown that it has had an impact for your office visits. And it just goes to show how data is king when it comes to making changes and implementing things in districts, because that is information you can take to your admin and say, this is working, and you can get backing from them. That's how things change, is when we have good documentation and keep track of those kinds of things. One other thing that I wanted to point out that I liked about what you're doing is that you're using the information from, or not information, sorry, when you're using educational lingo, because right now one of the things that a lot of educators are talking about is teaching resiliency, right? And so by just sending a kid to the health room, as soon as they have any kind of twitch anywhere or any kind of inkling of feeling sick, is not teaching resiliency. And so utilizing their lingo and critical thinking and resiliency is a really good way to get them on board and partner with you on that. So kudos.
Thank
Very
you.
good.
And our district, I mean, every district should be, but we've really been talking about data, collecting data to drive change. And so I thought, wow, this is perfect goal. It was one of my goals to start doing electronic data entry and then do something with the data. And I wasn't quite sure what I was going to do, but oh, this was perfect. It all just, you know, it's like the stars aligned, because I was just ready to pull my hair out. But it's a win-win for all. It really is.
No, that's awesome, and the data is showing that. And I know in NASN whenever they talk about data, they talk about data drives change. Data drives what we do. So good, excellent job. If anyone has any questions, now's a great time to ask. We will definitely be sending out Nicole's information, or her information, but also her slides and her handouts for you to be able to utilize. I know Amber, I'm really sorry, I'm gonna slaughter your last name. Is it Verelman? She indicated that she has a one-page guide that she also put together about when to come to the school nurse for her staff. And so that might be something that either one of these things that you could use and make it your own, make it work for your school's culture, because not everybody is quite the same in their districts, as you are well aware. So without further ado, if anyone has any last questions for Nicole, if you don't, then we will move on to having our update with Kathy. All right.
Okay, well, first of all, I'd just like to thank both Nicole and Michelle for volunteering to do presentations at today's meeting. All of you are involved in great quality improvement projects all of the time, and it's so important to be sharing with others what you're working on, because some of these same processes or similar processes can be adopted by other schools, and it's great to learn from each other. So if you have something that you would like to share with the group, please contact Lena, because she's putting together the agenda for the whole school year. So if you don't feel like you're brave enough to do it in October, maybe she'll book you for February. You could do a presentation then and give you plenty of time to put your work together, so that we can learn from you and what you're doing. So thank you both for providing that presentation. I'm looking forward to hearing the recording of this session today, so I can hear both these presentations in full. So thank you. So as Elena described, I'm going to be doing some updates. So I'm going to go back in to share my screen again, because I want to share some information with you. So is my screen visible? Okay, and first of all, I do want to apologize if there's any sirens or any noise. I'm sitting in a open area in a center here, and I think there might be some noise at times, and I am sorry for that, but hopefully there won't be too much. So without further ado, I'm going to again welcome everybody. I do want to make sure that we know who is here and everybody has a chance to connect with folks, and certainly to be welcoming Elena again on board. So this is just a short list of new staff. We do have a couple more openings that we're waiting to fill in our region, and hopefully we'll have them filled shortly. So I'm going to go through just a couple of things related to North Central ESD and some of the information we have available, and then we're going to swing into some Department of Health updates. So first of all, I want to make sure.
Could you put it on slideshow, because we're seeing your whole screen?
Oh, I'm so sorry, Ben. Thank you so much. I appreciate that. How's that look? Well, gosh, thank you so much for pointing that out. So this is a screenshot of the Google Drive and the link for the Google Drive to the All School Nurse folder. And I want to make sure that everybody has the link and that you are accessing materials in this way. We're in a transition period where we're going to be looking at taking some of the PDF documents off our School Nurse Corps web pages, and we're transitioning that information over into Google. And there's a variety of reasons for doing that, but certainly one of them is ease of updating. As new materials come out or things are changed, we can really quickly change them out on the Google Drive so that you are always accessing the most current information. So I do want to make sure you have access to it. If you have any trouble with this site, please contact one of us, either Sheila, myself, or Lena, and let us know so that we can help you ensure that you're able to get to it. We've done a lot of additions to the content this year, so you're going to find a lot of new information. You can certainly find things like all of our former newsletters are in here from last year. All of the orientation materials are in here from this summer. So if you're interested in seeing, for example, the entire binder of materials that's included in school nursing orientation, you can access the entire binder in there, as well as all the PowerPoint slides. And all the current information from Department of Health is all going to be housed in these different folders. So along with these, we do have some specialty folders. We do house the folder for Washington Best School Nurse Mentors. And so we do have a folder that's accessible to all nurses across the state. And those of you who are serving in the Best Mentor role or are just participating in mentoring of school nurses should have access to that folder, and you can get to all those materials. We have one folder that's specific to School Nurse Corps members, and then we have a number of team folders that are in there as well. So please don't hesitate to let us know if you have trouble accessing information in there, or if you ever get into the folder and you find that you think something is outdated, please let us know and we'll take care of getting it updated. A couple of subscriptions I want to point out to you. One is I want to make sure you're aware of the different electronic newsletters that we have available through North Central ESD. Certainly one of them is a School Nurse Corps. Whether you subscribe or not, you're going to be getting it because we'll send it to you directly. But we do encourage people to subscribe to it so they never miss a month's edition of that. There's also a couple of that might be of interest to you. One is the Safety Matters, and Safety Matters is all about school environmental safety, and you'll be able to, access posters, things that you can post in your school that address a wide number of safety issues. And so that might be of interest. And then the behavioral health newsletter as well is always a good resource on behavioral health resources and upcoming trainings that you could use to help your students. The other thing that I want to just share is that we do have a YouTube channel that's specific to North Central ESD. And on that channel, we keep a variety of videos. And one of those sub-channels is the School Nurse Corps channel. And so things like our School Nurse Corps meeting that we had in August, this meeting and future meetings, there will be recordings of those sessions that will be available on that site as well. And you can subscribe to that so that you can get notified when something new is posted. The next thing I wanted to point out is that for those of you that are familiar with Washington data sets, the data sets have been revised for 2023. And so we would encourage you to please review your data sets, compare them with the current version, and to update your sets in your electronic systems. Now, there is a link that you can access a folder that includes the new updates. It includes directions. It includes cheat sheets on how to do this work. But really, we would encourage you, particularly if you're new and you're not used to working with this system, with your electronic system, to contact your tech support in your district for some assistance on how to do this. It's not a difficult process. It doesn't take a lot of time, but we do encourage you to use the standard codes because if you do, you're going to get better data out of your electronic system, particularly when it comes time to do your district assessment. Your data is going to be more accurate, and you'll be able to actually enter data more accurately. These code revisions are The majority of the revisions are really based on school nurse input. So school nurses across the state, as they're reviewing their own documentation and they're reviewing available codes within the system, they provide input to a team who works on these codes on an annual basis. And so the code changes are just not made kind of willy-nilly. They're really based on how people document, the types of diagnoses that people are looking for, and then those changes get put into place annually. So just wanted to make sure you were aware that those have changed for this year. Another tool that I want to point out is a training resource list. This tool is used, we provide this during orientation, and some people have asked for it as well. And I think it could be a useful tool for others besides the new school nurses. And it is a tool that we've put together where training is all differentiated by topic. Many of the things that are available on here are provided free of charge. If there's a fee associated with it, we include the fee. And if you are a member of NASN, for some of these things that are posted on this training tool, which is about 4 pages in length, then you would be able to access those free as a member. So that training tool is posted again in the Google Drive. And so the link directly to it is on this slide. Okay, in terms of some of our health district reporting changes, I'm not sure if Dr. Wallace covered this or not in his presentation, but CDHD has changed their reporting tool for their 10% illness and absenteeism tool. And so I just wanted to make sure you were aware of that. It's wonderful. It's been converted into a fillable form at this point, and much easier for people to be able to complete and submit back to the health district. So the contact for that is Margot Lopez, and we've included her email here on the slide. And then the access link for this form, you can download this form and save it from Google. If you lose it, it's still going to be there in the future, and so you can easily get back to it. For those of you with Okanagan County Health District and Grant County Health District, each district does have a different process, and that could range from just emailing them when you get 10% to an alternative form to this. But just a reminder to check in with your health districts and make sure that they haven't changed any of their processes. They usually let us know, like in this case, they provided us with this new form, but if they have not, then you just want to make sure that you're following your own health district's practice in regards to reporting your absenteeism rates in your school districts. Okay, we're going to move into some Department of Health updates. First thing I wanted to point out is this Department of Health has been able to increase their staffing and really increase their focus now on school support. It's just been an area where there just have not been enough resources in the past for them to provide as much information and guidance and resources. And I think that became very clear, during the COVID, in the beginning phases of the pandemic, that there just weren't enough people to do the amount of work that was needed. And so they have been able to increase resources and therefore, increase their attention to school specific needs. One of the products that's available now is a new Department of Health school webpage. So again, your link is down here at the bottom. And the purpose of this page is really to be a resource for you. So this is not just for parents. This is really a resource where you can go and see what's the latest information coming out that is going to be related to schools, and particularly to school health. So you can see over on the right-hand side of the page under the toolbar, there's some quick links here that will take you to whatever is kind of the hot topic at that time, or maybe a new resource that they have put out and they want to make sure that's readily accessible to you, because sometimes even as they're redoing their pages, they find that things are still, might not all be together under one web page. You might have to hunt, they don't want you to hunt around, have to hunt and peck to find things. And so this gives you an opportunity to get to them more quickly. The next thing I wanted to show you is this is brand new. It just got launched within the last week, and it's called the DOH K through 12 Health Notebook. And again, this is a tool that they have put together to improve communication between the Department of Health and schools. And so this is a much briefer format. It's kind of like a little newsletter or a little Facebook, or just a little way that they can get some really quick information out to people without a lot of explanation, but links to where you could go to get more information about the subject. So this is a subscriber-based tool, and so the link is down here at the bottom. You can subscribe to this just as you can to North Central ESD newsletters. You have many newsletters available to you through OSPI and now through Department of Health that are subscription-based. So we encourage everyone to make sure not only that you are a subscriber to this, but that others involved in health within your school districts are subscribers as well, because they're including your administrators. So if they're not aware of this, this would be a great tool that you would be able to share with them because it's very brief and points out things that are happening kind of right now. Another new update over the past probably 6 months or so is the notifiable conditions poster. So take a look at the posters that you have currently. A lot of times you've got them posted somewhere in your health room, or you might have them copied and pasted into your infection control manual or posted on a bulletin board. Take a look at them and see if they look like this one, because this is the brand new version of it. Now, it is a bit longer than the previous one. Remember, it used to be a one-pager, so you could kind of print it like as 11 by 13 poster and get the whole thing. I'm not sure you're going to be able to do the same thing with this one. It's a little bit longer because there's more notifiable conditions have been added to it. So a little bit longer, but it is updated. And so we would encourage you to pull this one up. If you haven't found it yet on the Department of Health website, we do have it downloaded into the Google folder on Washington Department of Health resources. So you can also access it directly on the Google Drive. As far as immunization materials go for the 23-24 school year, I do want to point out, if you're looking for the updated immunization manual, there has not been one this year yet. We're continuing to use the 2022 manual as our guide for this school year. There were just so minor of changes that it was felt that the current manual would be fine for this year. There could be some future minor revisions to it, and if that does occur, we'll make sure that we get the new one out to you with some explanations of what the changes are for that. A couple of things you probably do want to download, and one is the IVERS manual. So IVERS is your individual vaccine requirements support tool, your summary, and it actually summarizes everything about all the different immunizations in it. So it's a really good tool to have. It did get updated this year, and so we would encourage you to make sure that you're referring to the current version of that. And the other thing that did get updated, of course, is the vaccine requirements for school. As with last year, the preschool through 12th grade is now one tool, so you don't have to have two different tools anymore. You can just use the one guide. All of the immunizations are printed to the front, and then further explanation of it is printed on the back. Both of these are available in the immunization folder on the Google Drive, as well as any other Department of Health immunization information is downloaded and on that Google Drive for you. DOH school module. This is just kind of a reminder that the DOH school module is still out promoting across Washington State and really encouraging every school district to participate in the school module program. So school module, as you know, is the immunization documentation system that's being used and is it's kind of an extension of the WAIS immunization system, and is designed specifically for schools, and is a great aid in regards to submission of your immunization status on an annual basis. So it's a great tool. And one of the reasons that there's so much emphasis on it at this point is because Skyward and Cumulative will discontinue their support of the electronic education record modules that are built into the system and have been used as a mechanism to record immunizations. Those are managed by a group in Washington referred to as WSIPSI, and because School Module is available and is an excellent tool, WSIPSI, it just isn't going to continue to maintain those elements anymore after this school year. So everything will work. If you're continuing to use either your Skyward or your Cumulative systems as your documentation system this year, it will provide reports for you, but after this school year, there won't be any guarantee anymore that it will be the correct information. So if your school is not yet moved over into School Module, we would encourage you to connect with them, with Department of Health. Actually, there's a School Module team who will help you with this system and help get you help your school district get transitioned over. I would encourage you to do that before the end of this school year so that you are all ready to go next school year with all your students built into the system. And then by the time you get into the next school year, everything will be set up for you. Some other new information from the Department of Health. Well, the wildfire smoke guidance has not 100%. It came out in June of 2023. So that's our current guidance on Department of Health air quality information and smoke. And so we'd encourage you to make sure that you're referencing that as your guide, and also the updates to the activities guide, which is over on the right-hand side of the screen and is actually did get updated. It got simplified this last year. And so they did make some pretty, significant changes to it to try to make it clearer, to make the language clearer for the users. And we have a lot of parents refer to this as well. So we wanted it to be a clear tool. And I want to thank those of you who are involved in this process and provided input to the Department of Health on this. Ben Schwartzel is on one of our Washington State Department of Health school nurse collaborative teams. And so he also was involved in this work effort. So thank you very much, because all that input from you makes this turn out to be a better tool. Now, if you review these things and you have questions about them, then please reach out. You can reach out to us at School Nurse Corps, or you can reach out to the Department of Health directly to get questions answered about these guidance. Another new product that Department of Health just recently put out, those of you who are familiar with I'm going to get up and move a little bit. How's the noise level, Lena?
Starting Sunday night, Monday.
Sorry, the noise, there's just a little bit of talking or something in the background, but it's really minor. It's good.
Okay. All right. Thank you so much.
Amanda needs to mute her microphone. Okay.
Okay, so Department of Health Respiratory Data Dashboard. This is brand new. This just came out, and this actually is taking the place of the COVID dashboard. So the COVID dashboard has been sunsetted, and this particular data dashboard is going to take its place. And the benefit of this tool is that it's going to not only report off on COVID-19 rates, but also flu and RSV activity. So you're going to be able to get a lot more information from this tool than you had before. This is going to be updated every week. So that's a benefit as well. And at least until April. Now, April, they're going to reassess to see how frequently does the data change? Does this need to continue to be updated, or can it kind of be closed at that point until there's more activity? But the access link is on here. You can access this tool directly through the Department of Health. So take a look. There's a lot more to it than this one page. So this is just one screenshot of the summary page, but you'll be able to pull up some graphs here and really look at the information in a variety of ways. So that'll be good. Good new tool. The other thing Department of Health wanted us to remind people of is that they do provide us with a lot of information around immunizations. And so this is an example of the immunization posters that they would encourage all schools to be putting up and sharing with their students and parents. And this is just the examples of these. There's different age levels of these posters, and they're available in multiple languages. You can print them. They're all 8.5 by 11 posters. And so again, it's just a way to connect with parents. It's a way to connect with people in the school and provide them with some good information about the need for immunizations. Now, we've downloaded those links to those posters in all the different languages. And so when you go to the Google Drive, you can pull up a document and it will have links to all of these tools in all the languages that are available. So great resources there. You might notice that the bottom of these posters list the date as 2022, but they are the current ones. I double checked with them, and there's been no revisions to the content, just kind of to the look and feel of these since they were put out last, and so they're encouraging us to continue to use these. A couple of other updates to point out. Many of you, I think, access the School Health Services electronic guidebook. This guidebook is useful for school nurses. It's useful for health room assistants, for principals, for superintendents, folks that would like to know more information about how health services operates in a step-by-step instructional guide. We maintain this manual on only one ESD website, and that is 105. Correct? I don't have my glasses on, so I'm having a hard time reading it. Does that say 105, Sheila? Okay. Well, the book has been updated again, and it's been relaunched. So it's been relaunched in a different format than it was before. The link is down at the base of the document. And if you haven't used it, or you're new to school nursing and you want to see how this works, please check out this document. It is fully electronic at this point. And so they built it in a new type of tool. And I'd love to get your feedback on how it works for you. It is much easier now to find things. You can link through the table of contents and just immediately jump around in the manual to things of interest to you. So please check it out, and please provide us with feedback. That is maintained by the School Nurse Corps administrators across the state. And so we're always looking for feedback on how to make that tool better. The other thing is the NASN Back to School Toolkit. They've just launched the 23-24 toolkit, and so you're going to find a lot of useful information in there as well. One of the things that I wanted to point out to, particularly to Sheila, who color-coded our own school nurse calendar for that we use during our orientation to help school nurses understand, from month to month, how their activities relate to the framework. NASN has included in their toolkit a kind of a modified version of that covers the same thing. How it is a breakdown of tasks that are completed on a month-to-month basis, and how those tasks actually relate to the school nurse framework. So lots of other tools out there. So please take a look at the Back to School Toolkit. I think it's going to be a big help for you. Other things that are coming up, these are pretty quick. All of these guidelines are in process. So we know that there are things that need to be reviewed, and they are all in the process somewhere. Some are getting close. So we might have the diabetes guidelines revisions perhaps within a couple of months, and then other things are going to take longer. So the AIMS manual, for example. So that's our asthma management manual. It's quite big, and we have a group who's going to be looking at that and making some suggested revisions to that tool. So lots of things coming. The how to respond to injury and illness at school. Everyone should have a copy of that in their health rooms. It is the guide for staff to be using when you are not available and they're responding to an injury or accident. So that's the Washington state guidance that is been approved by both the Department of Health and OSPI. However, it is not, we would like to see an update to that. The book itself is no longer in print, and so the only way to access it is to download it and print it. And what we would like to have some alternatives to that, as well as some updates to the book. The statewide standing EPI orders, that is still in discussion. And so for those of you who have been interested in having Parstock EPI available to you and have access to it through a standing order similar to naloxone, that is still in discussion. So I think it's getting closer. So that's the good, it's all positive discussions. So we're still working it out, but perhaps as early as this year, we might have some resolution to that. And then the naloxone distribution process, we're just looking at, are there better ways to help ensure that schools have their supply of naloxone available to them and they have sufficient amounts of that. So NEFI, I'm not sure how many people are familiar with NEFI, but the FDA decision date is today. This is going to be, they're trying to get approval for this medication, and this is going to be an alternative to epi auto injectors. So look at that little device. Doesn't that look similar? You know, so we'll have to pretty soon be making sure that all of our things are very clearly labeled on what they are, because we're going to have so many things using this little plastic nasal administration device. Anyway, we'll see what happens. So this kind of got put on the back burner in the past. It didn't get approved in May, but today they're going to be trying again. So hopefully we're going to hear some good news about that. Naloxone, just a few quick things on naloxone. For those who might not have a supply of that available, remember that we have several places where you can contact to get it free of charge. So Thriving Together North Central Washington, who is our accountable community of health and serves all 4 of our counties, is an access point. OMAC Family Health Centers through their opioid treatment network is an option. Grant County Health District overdose prevention and awareness program provides it. And we're also going to, we only have one of our doses left. We have a new batch that should be coming soon. So you can get help with naloxone both for free doses as well as training. So currently our state orders continue to be, you should have a current copy of the state orders, and continues to be the 2023 version. It will not expire, I believe, until January of 2024. And we don't know what kind of changes we could expect, but there may be some coming. Don't forget that we have a lot of tools available to you, like your checklist for training and other information about training materials and resources in the naloxone toolkit that's posted on the Google Drive. And then if you would like some information about the changes related to the over-the-counter availability of naloxone, there's a little video that was put out by the University of Washington that explains a little bit more about what having over-the-counter medications actually means in regards to naloxone. For our in-school status, I just was so happy to see, you know, when we did our district assessments, that really 100% of our schools who reported, and that was every school but one, did a district assessment this year, and 100% reported that they are in the process, or they already had naloxone, they already had policies, they'd already done training, or they were in the process of getting those things done so that they would all be ready to implement by the 23-24 year. So we're doing really well in that regard. Remember that our kit expirations, take a look at your kits, make sure that you haven't passed the expiration date. They're probably somewhere at this point. I would think they might be perhaps mid term to expiration, since many people just got them over the last year or two in their schools. But do take a look at that, and please make sure that your processes include not discarding any expired naloxone medications. If you have doses that have expired, please return them. Either return them to who gave them to you, return them to School Nurse Corps. We just want to make sure that they don't get discarded because they can be utilized. Even though, you know, school policy will say don't administer medications after their expiration date, we can still use them like through other programs that can use them. The other thing is to make sure that your naloxone is in what is considered to be an unlocked but easily accessible location. So along with your other emergency, probably you might be keeping it wherever you keep your other emergency medications. So somehow it needs to be readily accessible, but not so accessible that it is going to be taken and not available when you need it. So depending on where you have your naloxone spread out, you're just going to want to make sure that he knows where it is and can access it, and that it is available when needed. It hasn't been taken. And then the importance of having other emergency supplies available with it. Now, within our toolkit, we do have also these other forms, so we just want to make sure you're aware of them. And those are the forms for our local health jurisdictions for reporting use of naloxone and potential overdose. So you can take a look at all of those tools. Some of them are actually available in online forms where you can just download them or fill them out online, and very easy to do. And then some of them are paper-based where you could, again, complete them online and use them when you're doing any reporting to your LHJ. A couple of newer medications. These are newer things that are on the market, so you might hear about them. They are not included in our Washington State standing orders for schools, so they're not things that we would recommend, but we do want to make sure you're aware of them in the event that at some point they end up being included in our programs. Cloxato has been on the market now for a couple of years, came out in 2021, and it's an 8 milligram spray. So you get more. Certainly there's a lot of research that shows the need for doubling up on naloxone. You know, you give a dose of 4 milligrams and wait a few minutes and there's no response. And so that second dose is being given. And so now you have a pharmaceutical company who's come up with a 8 milligram dose and they're receiving that. So just know that that's available. It comes in a 2-pack, just like the 4 milligram doses. And it does require a prescription. So it's not just available over the counter without one. The other medication that's now on the market is a little bit different in makeup. It's called Opvi. Again, it was just approved in 2023, and it has only been approved, unlike naloxone, which is used for all ages, and Cloxato, which is approved for all ages. Opvi was only approved by FDA for ages 12 and older. So just another product that you might see or hear about coming out. Again, it also requires a prescription. A couple of other quick updates. It is Suicide Prevention Month this month. So we just want to, as a reminder, to make sure that you are helping promote suicide prevention resources for your schools and particularly your students. And there are many posters, you know, many websites available, and certainly we want to make sure that people are aware that they could call or text 988 anytime they need help. They're going to be able to connect with someone for some support. So there's a lot of resources here that you can access that will have more information about that. And certainly to keep in mind for those of you who are working with our Native students, that there are many resources available specifically for them. And these are just some examples of the different resources that you could connect with, particularly when you're posting information or posters for your different student populations. This is a new service that I want to make sure everybody's aware of. I think we've talked about it in the past, but so it's just more of a reminder that this program that Catholic Charities provides is available to you, and it's the Youth Mobile Response and Stabilization Services. And so this is something that you could share again with your students and your families. You can click on the link down at the bottom and it will take you to the Catholic Charities site where there's a large description of what this program is like and how these services can work. But it's really intended to help people who are just feeling like they are losing their ability to cope. They're having an immediate need for some support. And this group actually will send someone, whenever possible, they're going to send someone out to actually help that person. So very good service that's available. We hope people take advantage of that. Okay. Does anybody have any questions about moving into the new year, about any of these updates?
Kathy, there's a question in the chat from Nicole in Wenatchee. She asked, is it okay for students to carry Narcan at school?
Well, that would depend on your policy. What is your policy say about students carrying Narcan at school? You know, we can all have personal, we think, as far as how that goes. And certainly we also know that students self-carry medications and don't tell us that they have things either. So students can access Narcan the same as anyone else can access it. And so they could have it and they may be carrying it around. Whether or not your policy actually defines that and spells it out, that would be something that you would want to discuss with your board. And you know, because there is a self-carry policy, and the self-carry policy can be extended to other medications. It's not specific perhaps to just inhalers, you know, but it is a district decision on whether they're going to extend that self-carry medications. Good question. Thank you for asking. Any other questions? Okay, well, I think my time is up, so I'm going to leave you with this final note. Getting back to school is just the busiest time of year. You know, we think we are prepared, but I just wanted to point out that you guys always make it through with flying colors. I appreciate those of you who are able to reach out to other people and provide some support. And I'd encourage those of you who are new and feel like this feels kind of overwhelming, is that it is the beginning of the year. It oftentimes feels that way, but you do get past this. The end of the year by later in this school year, things are going, and then you'll be able to kind of catch your breath, and next year it will be easier, and the next year will be easier because the processes will be very, very clear. You know, you'll know exactly what to do when you return to school, and it'll be easier to get things set up. So anyway, I thank all of you, and I know it's time for us to log off. So is that correct? Am I done? I cannot see see here. Yeah. Okay. All right. Thank you so much, Lena. I appreciate you. And thank you so much, Sheila, for all your work on this meeting. Appreciate you guys. Bye-bye.
Thank you, Kathy. Bye-bye.